Thank you for tuning in to the San Antonio Express-News Medicare panel discussion. This panel is intended to provide helpful information to San Antonio and the surrounding areas with their Medicare needs. The discussion is moderated by San Antonio Express-News healthcare reporter Laura Garcia. Panel participants include Amanda Fredrickson, the Director of Advocacy at AARP, Martha Rodriguez, the Director of Population Health Management for Medicare at Community First Health Plans, Raul Gonzalez, the agency owner of Texas Medicare Solutions, and Kim Rodriguez, the agency owner of Coverage to Care. Laura, you can take it from here.
Thank you everyone for being here. Hi. So we have all seen how the COVID-19 pandemic has upended nearly every part of our lives over the past 18 months. How has it changed Medicare?
One of the things that I think has been really great about Medicare adapting in the time of COVID has been the expansion of the availability of telehealth. Now telehealth is much more available and it makes it easier for people to get care in their home, whether you've got someone who's frail and you don't want to expose them to, potential germs and other things in a doctor's office, or it might just be too hard to load them up in the car and take them in. It might be too stressful and not even necessary. So making telehealth more available is one of the really big changes that's happened in Medicare. It's important to say, though, it's not permanent. And AARP is fighting to make sure that once the public health emergency is over, that telehealth will continue to be a permanent benefit for Medicare.
So what are some of the changes coming in 2022 that beneficiaries really need to know?
Yeah, absolutely. There's a couple of important things with regard to even Medicare Advantage plans. I think that one of the things that a lot of people do, a lot of beneficiaries do, is they'll be enrolled in a Medicare Advantage plan and they won't review that plan going into the next year. And I think that this year, kind of more important than most years, is going to be an important year to get a review done so that way you can make sure that there's not new benefits. There's a lot of plans that are offering a lot more than they have in the past, more dental, more vision, and just a lot more extra benefits. We've even seen some plans that are offering healthy foods grocery card. So very, very important to review your plan this time of the year.
What are some other changes?
I'll definitely say that we are seeing these carriers now starting to show an even deeper personal interest to ensure that these members are able to access absolutely every possible care that's needed specifically for their health care. So we are seeing them go above and beyond to incorporate different things like pest control, targeting social isolation with in-home support, advanced directives. So I can definitely say with these Medicare Advantage plans, these carriers have definitely gone above and beyond to ensure that our clients, their members, are able to access the care necessary.
So you guys are mentioning Medicare Advantage. Can you break down some of the pros and cons between Medicare and Medicare Advantage?
I would say, at AARP, we think about it in two different ways. That Medicare Advantage is kind of like that fixed price meal, fixed price menu, where you have more limited selections, but you know exactly what it's going to cost. And then that Medicare fee for service is really kind of the buffet. And there are lots of options. And you have to really cull through those options. I would also say too that to Raul's point, so important that every year people review their needs and review what their current plan covers, because just because your drug plan worked for you last year doesn't mean that it's going to cover your same drugs next year. Similarly with doctors, hospitals, that sort of thing. So reviewing your Medicare benefits, what's available and your needs is so important, whether you choose original Medicare or whether you choose Medicare Advantage.
I'll definitely add to that to say that with some of those pros and cons, sometimes when people are reviewing their options with Medicare Advantage, they sometimes hesitate because they worry about the networks, that referral base. I'll definitely say that within the last few years, we have definitely seen these carriers definitely lean in and offer a lot more options when it comes to PPO. So it's not just an HMO model. When you think Medicare Advantage, know that there are other options out there that give you that flexibility to choose from in and out of network without a referral necessity. So there are lots of options out there. That is definitely sometimes seen as a con, but definitely can be a pro when you actually get a chance to sit with a local licensed insurance agent that can give you that review and look at those different options that you have.
So to that point, Kimberly, why really should you be sitting down with somebody, whether it be an insurance broker or somebody with the area agency on aging? I mean, why really do you need to kind of walk through that with somebody?
I will definitely say that with Original Medicare, whether it's just the educational map or looking at your different options, know that we are here as a neutral entity. And that's one of the major things that we like to explain and educate to our clientele, is that not only are we a neutral entity, but we are free of cost. And so what we do is we will sit with you, we will create a needs analysis for each individual client. And we'll go over different options that you have. As Amanda and Raul was saying, taking into consideration those doctors that you're seeing and the medications you're taking. But above and beyond that, Medicare is just not as simple as it seems if you are on the outside and you've never really done this before. So sitting with a local licensed agent makes such more sense than going with somebody through a call center that's in a different state. Because here we actually truly know the market, and we can definitely help decipher for what is going to be available to you and cater to your specific medical and financial need.
Raul, can you kind of, since you're a broker, can you kind of speak to that point?
There are so many options when it comes to Medicare Advantage plans here in the San Antonio area. It seems like every year we have a new carrier coming into town and offering new benefits. So that's why it's so important to speak with someone who knows this market. I always tell people that there's an option of calling an 800 number. I'm sure we've all seen the commercials on TV where they're saying, call in, you got to talk to someone now on the phone. The problem is that they don't know the actual physician group here in town. They don't know the way that my company and Kimberly's company actually know the different groups, which plans are working with which doctors. And so that's why it's so important to speak with someone at the local level.
Martha, can you kind of talk about that from the community health plans perspective?
Yes, I think as Raul and Kimberly have both said, there's differences between Original Medicare and the Medicare Advantage plans. And I think members need to really look at what their needs are at the time that they're entering into these plans. Some members may want to have, as Raul said, their own physicians that they've been seeing for years and years, and they may not want to enter into a Medicare Advantage plan where your network is going to be limited. But if you're somebody who is open to seeing various doctors and don't want to necessarily stick with one that you've been seeing for years in the past, you may want to look at a Medicare Advantage plan because it has additional benefits in the vision side, dental, prescription, the over-the-counter, transportation services, meal services. And so as been discussed, it's just a matter of each individual member determining before they enter into the Medicare arena, what are your needs and what is going to best suit those needs for you.
Amanda, so what we were talking about is here's some of these new shiny benefits available to the people who opt out of that traditional Medicare coverage and they sign up for the Medicare Advantage plans. Is there anything that you're seeing sort of nationally and locally that you could talk to about some of those benefits that we can expect?
Well, I think certainly some of the most popular benefits are those related to dental, vision, and hearing. You know, at AARP, those are the benefits we hear that people want the most in Medicare, whether they're an Original Medicare or Medicare Advantage. And right now, you know, the only place for folks to really find those would be in a Medicare Advantage plan. Always important to really, you know, cull through and see what the extent of those benefits are, but every year they change. And so, you know, really another reason to take a time to review your plan. But those are the three I would point to. I'm sure others have some other ones that folks are interested in.
What kind of financial assistance or resources are out there for people who need it?
You know, we mentioned earlier, I think you mentioned the Area Agency on Aging. For folks who think they might need a little bit of extra help and might be eligible, that'd be a good place to go. But there is help at a number of different points in Medicare. There's help for folks who might need assistance paying their Medicare Part D drug premium or their copays. And those income levels are pretty high relative to a lot of other assistance. You know, an individual can have close to, let's see, I want to be sure I get it right, but they can have close to $19,000 a year in income to be eligible for that assistance with drug coverage. And so I think if folks are concerned about what some of the costs might be, worth your while to sit down with someone and have them go through that process and see whether or not you're eligible. There's other assistance for people who are a bit lower income with Medicare Part B premiums and cost sharing in original Medicare. So a bunch of different options with different requirements, which is why sitting down with someone who can really look at your personal situation and help you is so important.
As far as the Medicare Part B premium, we definitely do find lots of folks, as Amanda mentioned, of those that are in the lower income and asset level that do qualify for this state assistance. But for those that don't, for 2022, we are definitely seeing that several carriers on both the HMO and the PPO product under Medicare Advantage are now also offering the Medicare Part B premium give back. May not be the entire amount, but there is a portion that is incorporated there depending on the plan you choose. So there are options out there, even for those folks that may not qualify due to low income and assets.
So Kim, can you tell us about the deadlines and, you know, what is the timeline here? Like, how long do I have to look at my plan and sort of make that decision?
Deadlines for Medicare Advantage plans run from October 15th through December 7th. That's known as the annual enrollment period. This is a great opportunity for clients, whether you're just coming into Medicare or maybe you've been on Medicare for years. This gives you an opportunity every year during that time to look at your options and definitely know that these agents can start discussing these benefits for 2022 as early as October 1st.
Okay, so you can get in there a little bit sooner if you need to, but that's that time period that you have to sort of to sign up or enroll, change your plan if you need to.
Correct.
Very good. Okay, so in 2020, the Medicare Fraud Strike Force, a joint initiative between the U.S. Department of Justice and Health and Human Services, which works to prevent and deter fraud, they took down schemes that involve more than $6 billion in loss. I'm sure this is not news to y'all, but is this something that we see in San Antonio? And how can we prevent from becoming a victim of these scams?
We're seeing it almost every day. Somehow I got onto a list of people that they think I'm 65 or older. And so I've received a call pretty much every single day. And we actually will even get people saying, hey, I'm calling from Medicare. I'm calling from Social Security, and we need you to just verify your Medicare ID number. They want you to give it to them. So I would say if anybody calls you and they say that they are calling from Medicare, that's a big sign right there. Medicare is not making outbound calls right now. Social Security is not making outbound calls. So if you get any kind of call like that, do not give any of your personal information. What I would do is hang up, and then I would call the local number. I would call the 800 number for Medicare, and I would call Social Security and just make sure if it sounds like they have a pretty convincing reason to be calling, I would actually make that outbound call, because then you know that you're the one dialing in to 1-800 Medicare or to the Social Security office. So that's what I would do. Another thing that we're seeing is just telemarketers that are calling and misrepresenting themselves. Again, what we would say is I would not recommend speaking to them, because they're doing things in a way that is not compliant in the first place. And so agents should not be making outbound calls for Medicare Advantage insurance. That's a very important thing to know. So I would say, again, that's why we talk to someone local.
Martha, what are you seeing?
As Raul said, we've heard many instances of individuals receiving calls, and as Raul indicated, Medicare is not making outbound calls. They also are not making house calls. And so we've also heard of instances where individuals have asked not only for the Medicare ID, but for their Social Security number. And I think the important thing for everybody to remember is you don't give out those forms of ID. Those are private to you. And if somebody is, I think we've heard of individuals being offered a gift card if they answer a few questions, and usually those questions involve giving out private information. We also recently identified some potential Medicare members that have been receiving calls indicating you're eligible for a piece of equipment. Give us your Medicare ID and we'll go ahead and purchase that for you and then send it to you. And what they don't realize is these are scammers. And so by doing that, you're limiting your benefits. They're going to go ahead and charge the plan that you're on for that equipment. And then when you need that equipment, you're not going to be able to receive it because you've already exceeded the limit of your plan.
That's really scary. That, I mean, I think we all kind of get those telemarketer, those calls all day long. And it's, you know, sometimes you're not sure if they're real or not, but it's a good sort of tip is that Medicare is probably not going to be calling you directly.
No, and I think what you mentioned, Laura, is we don't know whether they're real or not because they are calling from numbers that appear to be legitimate. And that's something to be aware of. And as Raul said, you hang up and then you call a number that you're familiar with and find out, was that a legitimate call or not? And usually they are not legitimate calls.
Very important information. Thank you so much for sharing that. Is there anything else that really beneficiaries should know coming into this enrollment period?
Every year, late into fall, really into annual enrollment period is when we also start seeing Medicare.gov publish the changes as far as the Medicare Part A deductible and the Medicare Part B boy deductible, and then also the Medicare Part B premium. So know that those premiums can definitely fluctuate. Over the last 15 years of experience that I have doing this, we have definitely seen that premium increases every other year. So definitely be on the lookout for that, especially for those that are actually having that premium deducted out of your Social Security check. Starting next year, you may see a little bit of a decrease in your Social Security check due to that Medicare premium increasing.
That sounds like if you're going to be paying a little bit more, you should really know what your plan offers for you so that you're making use of that plan, right? Amanda, anything that you're seeing that folks should really know going into this? People's needs have changed over the last couple of years. You know, they change all the time, but in particular, I think people have experienced in this age group have experienced a lot of changes. And so it's just really I feel like a broken record, but it's really the time to review and just to be clear with folks that this is your chance to review your plan so that your coverage starting January 1, 2022 works as well as it possibly can for you. And I just think it's important that folks take that time. And they should also, I don't think any of us have mentioned this, but they should be receiving a notice in the mail about now of any changes to their existing plan. So that's always a good place to start, because if you like the plan, it worked well for you in 2021, at least take the time and look and see what's going to happen and what's going to be different in 2022 and assess whether or not you want to then have a larger conversation with someone to help you see what your other options are. Thank you all. Thank you. I appreciate you for weighing in. I don't know if there's anything else that we should mention.
I'd like to incorporate just one more thing for those that either are just coming into Medicare or maybe you have actually worked past the age of 65. Remember that there are lots of discussions out there about late enrollment penalties, how those apply, who they apply to. Don't always assume that you will automatically be in a late enrollment period just because you did not sign up for Medicare at 65. If you have credible coverage through an employer, you will not have to worry about a late enrollment penalty. And also I'd like to mention that for that Part B premium, sometimes we do see clients that are actually at a higher income level that will actually pay more than the average premium. So this is where it's super important for you to meet with a local agent that can help break down all of those different avenues of what exactly your particular Medicare is going to look like. And we definitely will be more than happy to go over that information, again, free of cost.
Lots of really good information here that we've discussed. Thank you all for joining us.
Thank you for joining us. And if you would like more information on Medicare, please go to www.mysa.com/Medicare.